now we will be demonstrating or administering subcutaneous injection. So the first step is to perform hand hygiene and observe the appropriate infection control procedures. This is to reduce the number of microorganisms on the hands. So since we are done washing our hands, we will now proceed to the next step. So after performing the hand hygiene, we will now proceed in preparing the medication from the vial or ampule for drug withdrawal. Organization of necessary procedure facilitates accurate skill performance. And after which, we'll now introduce ourselves and verify the client's identity. And also, we will also provide some privacy. This is to give assurance to the client and verify the client's identity by checking the ID band or bracelet to gather information. So, assuming that the patient is this Tomato. So, hi, Mr. Tomato. I am your student nurse for today, and I will be administering subcutaneous injection. Is that okay for you, sir? Okay. So, the next step is to assist the client to a comfortable position. This is to provide clear visualization and easier contact when administering subcutaneous injection. So the next step is to explain the purpose of the medication, including relevant information about the effects of the medication. So, hi Mr. Tomato. I will be injecting you subcutaneously, and this is to strengthen your immune system. Is that okay, sir? Okay, sir. Explaining rationality increases the patient's knowledge and reduces their anxiety. So the next step is to select a site free of tenderness, swelling, scarring, itching, burning, or localized inflammation, and one that has not been frequently used. Because lumps may indicate a previous injection site where absorption was inadequate. So after selecting a site, put on a clean glove. So I am done putting my clean gloves because I am done washing my hands. This promotes safety from any pathogens. So after which, we'll now clean the site with an antiseptic swab. Start at the center of the site and clean in a widening circle to about 5 centimeters to 2 inches. Allow the area to dry. So I will now get a cotton swab and an alcohol to clean the area. Cleansing the injection site prepares it for the injection. And after which, place and hold the swab between the third and fourth fingers of the non-dominant hand. This allows for easy access to dry gauze after the injection. So we will place it here. And after placing and holding the swab, we will now remove the needle cup by pulling it straight off. This technique lessens the risk of accidental needle stick. And after which, we will now hold the syringe between the thumb and the forefinger of the dominant hand. This position prevents accidental medication loss while inserting the needle. After holding the syringe, we'll now pinch the skin with non-dominant hand. In order to lift and away from the underlying muscle tissue. And now we will inject the skin with bevel up 45 to 90 degrees. And release the skin to avoid injecting into decompressed tissue. We will now grasp the lower end of the syringe with non-dominant hand and position dominant hand to the end of the plunger and do not move the syringe. This is to prevent the movement of the syringe. Now pull back on the plunger to ascertain that the needle is not in a vein. This is to prevent the patient from having a collapse on the vein when pulling back on the plunger. Now we quickly withdraw the needle while applying pressure with the antiseptic pad. Withdrawing at the same angle prevents tissue damage and helps control bleeding. We will now assist the client to a comfortable position. This is to provide patient's comfort. And after which, discard the uncapped needle and syringe in a disposable needle container. So I will get the cover of the needle and dispose it properly. It is because most accidental needle sticks occur while recapping needles. This prevents injury. And we will now remove gloves and wash hands. This is to prevent the spread of the infection. And the last step is to document all relevant information. Documentation provides coordination of care.